All right, so we're gonna do IV catheter practice right now. This cat is really loving its pre-med, so I think I can turn the clipper on as close as can be, but sometimes when you have some of those patients that aren't quite as pre-medded like this cat, you might want to start your clipper a little bit farther away and then kind of bring it up, touch your hand, touch it to their limb and see how they react. This cat is not reacting at all. So we're going to go ahead and do some clipping. And so we want that clipping to be rather large so we don't get any of the cat's hair in the catheter area. We also want it to look rather neat because this is part of the area that your patient will see once they get their cat back. And we also want to start low so we have all this room up here to use if we aren't able to place that catheter down below. We have plenty of space up above here. So always want to put some alcohol on it. When I do my alcohol, I do it nice and close to the skin. You can't even hear that. Doesn't scare the patient. If I were to go way back here, the spray could be really loud, could scare that patient, but when you do it right next to that skin, they tend to not even notice it. So I'm gonna bring my fluids a little bit closer to me here. So for my catheter here, I don't enjoy having this piece on the back, so I'm always gonna take my back piece off here. All right, so I'm going to have bevel up. I'm gonna make sure my little divot here things are gonna be in a place where I can move them with my fingernail. And I always kind of do a little, I guess, setup just to make sure that they are easily detachable from each other. Make sure that one of your fingers is kind of on the hub and also on the catheter, and then that you can also see your clear part of your stylet there so that you can see when the blood is coming in. You won't see any blood up here, it's going to be in the clear area. All right, so I have my stylet up. I'm gonna move this, there we go. All right, so you guys ready to poke? Here we go. And this is a tomcat, so he's got some tough skin. So there we go, see some blood coming right now. It's still filling up, so I know I'm in the vessel. So I'm gonna go ahead, leave my stylet in place, but go ahead and slide my catheter right off of the stylet. See how I left the stylet in place? Then I'm gonna ask my restrainer to go ahead and let up from the vessel from back there and hold off right about here. So then I'm gonna take my stylet out. Try to put it someplace where you can't poke anybody if possible. So she's gonna hold off right now until I can get my T-port available. And then I am going to go ahead and tighten that as much as possible. So you can hold on to that hub and tighten right there as much as possible. So then I always want to keep one finger onto my T-port, and I can let my restrainer just go right back behind the elbow to make sure that patient doesn't pull their limb back at all. So now I'm gonna hit start on my pump here. And so now we can see that it is going. So just don't hold off, just let it flow. And so we're gonna start taping. And like I've always said, taping is the hardest part of practicing catheters. So we wanna start with our skinny piece here. We're going to go under with the sticky part on top. So remember, the catheter is in here, but I can bend this as much as possible pretty much, right? I like to use both fingers, so you can use both fingers to put this as low as possible. Go ahead and drape over. And then go, oops, sorry buddy. Go around that limb as much as possible. And then you'll have your end that will be already tapered for you. So now that we have that one piece in, we kind of have that as our anchor piece so we can let our hands up. Next, we're gonna grab our second piece, which should have a little cut in it like this. The cut is so that we can go underneath our catheter again, and we wanna slide that right to that skinny piece. We're going to go around the limb and go right onto that hub of the catheter. Do not go onto your T-port. We're just gonna go right on to that hub. Okay. So I always like to pinch it a little bit around the catheter to make sure it's in a good spot. Lastly, we take this pants piece and we're going to go and put this around your T-port. So watch carefully as I put this on. So you're gonna put it above your T-port line. So right here, cross one way and then cross the other way. And it's still above your T-port line. And then you're gonna bring it one way to one side or the other. Sometimes you may see your catheter is kind of going off to one side, so this kind of helps bring it back if you want to try to center it. So we're gonna bring it off to the one side, tape it around, make sure it has a tab, and again, I like to just squeeze around to make sure it's on my T-port nicely. And there we have it, nice and secure. And hopefully it shouldn't fall apart from where it is connected to your catheter.